Good morning. My name is India, and I am your registered nurse for today. And I'm here to get you ready for Mohs procedure. So, Mohs procedure is specifically designed to treat skin cancer, and in your case, you've been diagnosed with basal cell carcinoma. The basal cells of the skin help regenerate new cells when the old cells dry up and die off. And so your cells have been damaged by the sun. So it looks like you have a few areas in the cheek area above the zygomatic bone. And what we're going to do is identify those areas first, mark them off, and then we'll prep you for your procedure. Now, you are going to be here for about 4 hours today. This is an inter-office procedure. You won't be put to sleep. We will numb you a little with some local anesthetic in the area. You're going to feel a pinch and a burn, and in a few minutes after that, it will be numb. Prior to doing that, we're going to clean the area with a local antiseptic a topical antiseptic where you are getting rid of the germs, and it pretty much allows you to be infection free. So we're trying to reduce your chances of getting an infection around the skin. Okay, so after you get numbed up, the physician is going to remove the damaged tissue and try to preserve as much healthy tissue as possible. That is the purpose of this procedure. And the goal is to be cancer free. All right, so what we're going to do is use a scalpel and make a clean incision. We're going to use a curette, which will take out some of the bad tissue, or as much bad tissue as possible. There are other instruments that are involved as well that will grasp the tissue to make sure that the tissue remains healthy. And then we'll use a cauterizing device to stop the bleeding. At this point is when you will probably need sutures, and that's just a fancy word for stitches. And those sutures will go across the line to stop across the scar area or where the incision was made. It's not a scar yet, but it might potentially become a scar. But we're going to try to reduce the scarring as much as possible by placing those tissues together and doing a nice suture. And then you'll go home with a bandage. So there's going to be a pressure bandage there for a couple days, and we'll show you how to care for your wound. And then in 1 week, you can return, and at that point, we'll evaluate your healing process. Okay, so what happens after he removes some of the damaged tissue? We're going to place it on some slides and send it to our histology group, and they will review it. So once it's under review, we're trying to look to see if all the bad areas have been removed and the clear margins for healthy tissue are there. And we can maintain a healthy area on your face so that it heals properly. And the goal is to be cancer free. So about this success rate in this procedure is about 98 to 99%. So we are confident that this will be a pretty successful procedure. If anything else arises, your doctor will let you know. Dr. Jackson is a board certified dermatologist and general surgeon, been practicing for 25 years and is pretty good at what he does. So we look forward to caring for you. If you have any questions, please let me know. Good luck on your surgery. Let's get started.